It's a pleasure to be here to talk to you about approaches to tackling mental health in the workplace. Mental health is a dynamic concept, suggesting that it exists amongst a continuum. So just because I don't have mental illness doesn't mean I am mentally healthy. Mental health is not the absence of illness. If we look at what mental health is, it's really around the capacity to think, feel, and act in ways that are going to enhance our quality of life, in addition to cope with the normal stressors. First of all, we know that approximately 1 in 5 individuals are going to be impacted by mental health issue. We know that this is just not a Canadian problem, but it's actually a worldwide issue, with mental disorders being the leading cause of disability and ill health. It's a fatal disease. There are approximately 11 people per day dying by suicide. There's 1 million over the year, World Health Organization is estimating. The number's too high. There's still about half of us that are seeing it as an excuse, which really creates a barrier to getting those who need help to the right place. And then, with that stigma, those who are affected are not accessing the support or help. So when we look at it within the workplace, it's the leading cause of disability in Canada. When we look at the disease burden, it's about 1.5 times higher than cancers and 7 times higher than infectious diseases. Typically, traditionally, the line of defense is more reactive, those EAP programs. However, 2/3 aren't accessing them. There has to be an emergence of a health culture. And so I think this needs to stem from the leadership, needs to stem from the organization. And the good news is 86% of employers are thinking it's important to take care of total employee wellness, with emotional well-being being the highest rank. This compared to only 29% 3 years ago. We also need to intervene at the management and leadership level. Mental health literacy, anti-stigma campaigns, so that individuals who are impacted are able to get to support quick enough. Then there's that individual level. We need to give them coping skills and resources and tools so they can tolerate the demand and stress and act effectively and handle all those challenges. And then when we're moving further down the continuum, it's what is the screening that we're doing to create that awareness of where people are at. And then lastly, the return to work, which I find as a psychologist is often missed. Okay, so digital, technology. The organization that gets this right is going to have a competitive advantage. I really see this as the next wave. Having said that, because mental health and digital is the new trend, you're going to have everyone popping up their shops, right? So make sure you read the science, make sure it's efficacious, and that there's good rigor towards the intervention. And lastly, the solutions need to be evidence-based and engaging and relevant for today's workforce. 50% of the population are the millennials. They're on their phone 217 times a day. So we need to make sure that there's that digital component and that it's engaging, because there's no point in having a solution that people aren't going to use.